Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Some people who are thought to have Alzheimer's disease because of cognitive decline actually have a condition known as LATE, L-A-T-E. I'm talking about this condition with Dr. Sharon Brangman. She's Upstate's Chief of Geriatrics and the Director of its Center for Excellence for Alzheimer's Disease. Welcome back to The Informed Patient, Dr. Brangman.
Thanks for having me again.
I don't think many people have heard about LATE. What can you tell us about it?
Well, LATE is an acronym or an abbreviation for a condition that's called limbic-predominant age-related TDP-43 encephalopathy. So you can see why they call it LATE. And it is something that we've seen clinically for many years, but it was never formally defined until about 2019. And what happened in those years in the early 2000s, we started to have biomarkers or evidence of Alzheimer's disease that could be seen in the blood or in the spinal fluid. These are markers of abnormal proteins that build up in the brain in Alzheimer's disease and are in the spinal fluid and in the bloodstream. So we would see patients who would have symptoms that look like Alzheimer's disease, but when we did further testing on them, they didn't have any of the markers that would indicate Alzheimer's disease. So it was a kind of mystery about what was going on. And so a group of experts got together and called this LATE, which is a special branch of dementia that's usually seen in people who are 80 and over, who have a lot of the same signs of Alzheimer's disease, but it's less severe than typical Alzheimer's disease.
So is LATE a type of Alzheimer's disease or is it different entirely?
Well, it's a type of dementia, and it is caused by a protein that's different from the proteins that cause Alzheimer's disease. So it's a related disease, but it's different from Alzheimer's. As we learn more about the brain, we understand that there are certain proteins that are abnormally built up in the brain with certain kinds of dementia. And in Alzheimer's disease, that protein buildup is due to amyloid and tau proteins. And in LATE, it's due to a protein called TDP-43. And interestingly enough, this protein is also seen in ALS or Lou Gehrig's disease.
Let me ask you, how would a family be able to differentiate, or maybe they couldn't, but what are the symptoms of LATE and how do they differ from the symptoms for Alzheimer's?
Well, it's very tricky even for experienced physicians to tell these two apart because there's so much overlap. But usually LATE is a little less severe and it progresses more slowly. We can still see memory loss. We can still see people who have trouble with word finding or understanding words and trouble kind of keeping information organized. But it doesn't often have other physical problems associated with it, like, say, having trouble controlling your bladder or bowels. It may not have behaviors associated with it. However, there's often a mixture of all the different types of dementia in a person's brain. Very few people have one type at a time. And we find that about 50% of the people with Alzheimer's disease also have LATE that's occurring with it too.
Now, when they come to a geriatrician's office, a specialist, the blood test, does that give you the diagnosis if they have that protein, that TDP-43? Or how do you diagnose them with this?
Well, right now, there's no way to diagnose LATE except by an autopsy. So if we have someone who comes in with symptoms of memory loss that sound like Alzheimer's disease, and we do a specialized PET scan called an amyloid PET scan that looks for that amyloid protein, And if it isn't there, then we might think that they have late. So it's
And
really only diagnosed by an autopsy, and it can be very tricky to diagnose. So there are many types of dementia. For example, there's Alzheimer's disease, there's vascular dementia that you can have from having mini strokes, there's a Lewy body dementia, there's different types of dementia. And some people have a mixture of dementias. So they can have Alzheimer's disease, they can have late, they can have vascular disease, and they can have late. Late as an entity in and of itself occurs in about 40% of patients. And so we're starting to understand that if we have an older patient, somebody who is 80 and older, and they have a very severe, rapidly declining and progressive Alzheimer's disease, it's probably a combination of Alzheimer's disease and late.
this is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Sharon Brangman, who is the Chief of Geriatrics at Upstate, about the difference between Alzheimer's disease and a related condition known as late, or LATE. Now, you mentioned some similarities with ALS, amyotrophic lateral sclerosis, or Lou Gehrig's disease. Can you tell us more about that?
Well, this protein, TDP43, is present in the nucleus or the center of our cells in our body. Just about every cell has it. But something happens that makes that protein leave the nucleus or the center of the cell and start spreading inside of the cell where it causes damage. And we don't understand why. We don't understand what triggers it. It may have a genetic component. There's another gene called ApoE, and people who have that ApoE4 gene have a higher risk of getting Alzheimer's disease, and they may also have a higher risk of getting late. But there's still a lot of research going on, and there's still a lot of unanswered questions.
So, what treatments are available for late at this point?
Well, there are no specific treatments for late, but it looks like the medications that we use for Alzheimer's disease, such as donepezil or rivastigmine or memantine, would work for late. However, you might have heard, and I think we've talked before about some of the newer drugs for Alzheimer's disease that attack those amyloid proteins. And since people who have late don't have amyloid buildup in their brain, they're probably not going to be good candidates for these amyloid protein busters, these anti-amyloid agents. If they have a mixture of Alzheimer's and late, where they have a little bit of amyloid and we think they have late, we really don't know if the anti-amyloid medications will be beneficial to them. So there's still a lot of questions that we have about late because it's a relatively new entity. And even though we've seen it for many years, we never really had it well defined until recently.
Do we know enough about it to characterize the type of person that might develop late? Is it more common in men or women? Does it affect people younger, older, different races?
So no, I don't think that it has any other risk factors other than it's usually in the older patients that we see. So it usually occurs in people who are 80 and over. There's always an exception to every rule, but in general, this is a disease of the very old, and it's a milder form in that it progresses slower than Alzheimer's disease, but it still doesn't have a cure, and it still leaves people with memory problems.
So, what do you say to families when they receive this? I guess it's not really a diagnosis, but if you're talking to them about you think that this is what their loved one has, what else can you offer them?
Well, there's no treatment that will cure late. There's no treatment that will cure Alzheimer's disease. We have some treatments that give you some moderate benefits from the anti-amyloid drugs, but they are not cures. So we talk to patients and families about different kinds of brain diseases that overlap with each other, and that right now we can take care of you and help you manage the symptoms and we can help provide support to the family members, but we don't have a cure for it.
Now, I believe with people who are diagnosed with mild cognitive impairment, the patient themselves can be part of the discussion and understand some of what's happening, right? Is that the case with someone who gets diagnosed with late?
Well, we try to involve the patients whenever possible in the discussions, depending on their individual circumstance and ability to participate. So it's not necessarily comparing it to mild cognitive impairment. It's just that when you have somebody with a diagnosis of a memory problem, we talk to them so that we can help them understand what's going on and what options are available. And that even though we can't cure, we can still take care of them and help them manage as best as possible.
I think you gave the number 40% earlier. Is that the number of people with a cognitive condition that turns out to be late?
Yes, we think that late can occur as a mixture with Alzheimer's disease or a vascular dementia, or it can occur alone. So we think that about 50% of people with severe symptoms of Alzheimer's disease also have late, and maybe about 40% of people who just have late all by itself is about the occurrence rate. But we can't be absolutely sure unless the person agrees to an autopsy, because these are all clinical diagnoses, meaning we're making the best educated decision we can based on someone's symptoms, but we won't know for sure because there's no blood test or brain scan that will tell us the answer.
Is the prognosis the same as it is for someone who has Alzheimer's disease?
So if you have late without Alzheimer's disease, it's usually a little bit milder and a slower progression. And we may see fewer physical findings and maybe fewer behaviors. If you have Alzheimer's disease, that can often have a span of 10 or 15 years because it can happen earlier. It can happen in the 60s or 70s, but late tends to happen to people in their 80s.
So you may have Alzheimer's for many years before developing late.
That's true.
Well, this has been very enlightening. I appreciate you making time to tell us about this, Dr. Brangman.
Well, I think what this really highlights is how much research is going on right now about the brain and how much we're learning on a regular basis. These are issues that have been present for years and years since the beginning of my practice of medicine. And it really isn't until the last few decades that we've started to get some clarification, but we still have a long way to go.
It sounds like with every discovery, there's more potential for treatment, maybe.
So that's the goal, is the more you understand about the brain and all its complexities, and if you can start to sort it out, then you can start to find specific treatments. We know that most of the problems that we see are going to be complex and they may not have a one option treatment. They may need multiple approaches. And as we learn more and more about the diseases of the brain, especially as we get older, we will then have research that can address those issues. So this emphasizes the importance of ongoing research and the importance of people not assuming that memory loss is a normal part of aging. If you have a problem with memory, you should come to our office and get evaluated, because there are lots of things that we can look at to try to help sort it out.
That's good to know. Well, thanks again. My guest has been Upstate Chief of Geriatrics, Dr. Sharon Brangman, who is also the Director of the Center for Excellence for Alzheimer's Disease. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.